Coming to the hospital can be scary for kids, especially if they need to have a medical procedure. Comfort positioning is when a parent or caregiver uses their arms or legs to hug, hold, and support a child during their medical procedure. Children often feel more scared when they need to lay flat on their back for a medical procedure. Letting them sit up in a parent or caregiver's lap can help them feel safer and more confident and in control during a medical procedure. A comfort hold also gives caregivers the opportunity to be active and supportive during their child's procedure. Comfort holds are easy to do, but it is important to follow some simple techniques for success. First, you want to make sure that you hold your child firmly. The more contact your body has with your child, the better the hold and the safer your child will feel. Limit your child's movement as much as possible. It's important that the part of the body being worked on by the healthcare team is held tightly. Sometimes an extra holder will help hold the part of the body where the procedure is being done for added support. Encourage your child to play, listen to music, or watch something. Distraction can be a powerful tool to help keep your child calm and cooperative. Encourage your child to take deep breaths, count, squeeze a stress ball, or another form of relaxation can also be helpful. Have one person be the calm voice to speak to them. This helps keep the room calm and helps the child focus and avoid getting overwhelmed. Focus on talking with your child about topics that are not medical, and encourage your child to use coping strategies. The first comfort hold we will go over is the chest-to-chest hold. In this position, the child straddles the parent's lap, facing them. The parent holds the child closely, chest to chest. The parent's arm can be over or under the child's shoulder, and the other arm across the child's back. The child's head rests securely on the parent's chest. This position is great if the healthcare team needs access to the child's arm, leg, or back. It is also an ideal position for children who prefer or do better when they are not able to watch the procedure. This position works best with children 2 to 8 years old. The next hold is the side sit hold. In this position, the child sits sideways on the caregiver's lap with their legs to one side. The side of the child's head rests on the caregiver's chest. The caregiver's hand and shoulder are used to hold the child's head to the caregiver's chest. The caregiver's other arm is wrapped around the child's arm. This position allows the healthcare team access to the child's arm, leg, back, or side of the head. This position is great for older children and children who prefer not to watch the procedure. Another hold is a back-to-chest hold. In this position, the child sits between the caregiver's legs and leans back on their parent's chest. The parent's body supports the child's body, allowing maximum body contact. The parent sits on a bed or chair, resting their back against the bed or back of the chair. A pillow can be added for comfort. The parent hugs the child's upper body and below waist. The child's feet can be covered with the caregiver's leg or a blanket. This position allows the healthcare team access to the child's arm, body, leg, and face. This position works best with children 1 to 8 years old. For babies, a snuggle and swaddle hold is ideal. Wrap your child in a blanket and cuddle them close. This hold works best if the parent can lay down on a bed or exam table with the child. Babies can remain swaddled in the caregiver's arms. If the healthcare team needs access to the child's arm or leg, it can be removed from the blanket while the rest of the child's body remains swaddled. At Children's Hospital Colorado, we have certified child life specialists whose role is to help prepare and support children for stressful healthcare experiences. Their goal is to help children and their families cope while they are at the hospital. Our team of child life specialists can help you and your child come up with the best plan to help your child cope with their medical procedure. If you are interested in having support from one of our child life specialists for your child's procedure, just ask your healthcare team. These are some helpful tips for supporting your child through a medical procedure. Explain the reason for the procedure and what to expect to your child. The more they understand, the less anxious your child is likely to be. If allowed by the healthcare team, bring a comfort item, such as a special blanket, stuffed animal, or pacifier with them to have during the procedure. Have your child take slow, deep breaths. Take a big breath through your nose, then blow out through your mouth. Do this before, during, and after the procedure. Before and during your child's procedure, have them squeeze their hands together or around a ball. Squeeze and hold for 5 seconds, then release. Sing or listen to soft music during the procedure. Before the procedure, have your child picture a favorite place or activity. Encourage them to think about what they see, hear, smell, and feel when they are there. Help your child try to stay in this calming place during the procedure by engaging them in conversation about their special place. Even babies need help facing stressful situations. Luckily, there are many things you can do to help your baby cope with a medical procedure. Wake your baby before the procedure. It can be very upsetting for a child to be startled awake by a procedure. If time allows, provide skin-to-skin with your baby 5 to 10 minutes beforehand. Hold your baby close so they can feel your skin. Tightly wrap your baby in a blanket, leaving the area of the body out that is needed for the procedure. Breastfeed your baby, give them a pacifier to suck, or, if it is appropriate for your child, ask for sweet-ease from your doctor or nurse. Sing or shush softly in your baby's ear.